It is time to get started on your C-section recovery. In this video, we're going to discuss the objectives of this part of your recovery and answer some frequently asked questions. The techniques that we're going to go through in this section are not new. In fact, they have been used far and wide in rehab after many other surgeries. After completing these videos, it is my hope that you have an idea of the importance of scar mobilization and have the confidence to do this technique on yourself. I just want to note that as I cannot see you in person and assess you properly, all of the information in these videos is for educational purposes only. It is not a replacement for medical intervention. I would still highly recommend that you see a pelvic floor therapist for more in-depth scar healing strategies. Okay, so what are the objectives of this video? Well, number one goal is to help you heal in both mind and body and kind of understand wound care and scar maturation. In other words, how do you know if your wound is healing and gain an idea of what to look for in your own skin and be able to evaluate it to some degree so you know how you're doing in the healing process and you'll know when intervention might be necessary. On the other side of everything, there is a very holistic impact of having a C-section and the role of C-section mobilization. We can also offer to do meditation, some self-reflection, journaling, etc. during this recovery period. C-sections are not always the main plan and take some processing. They can take a lot of healing work on an emotional level and often require you to give some intentional attention to the scar in a kind and loving way. However, there can be some resistance to this. Often heard my clients say, oh, I don't want to look at it, I don't want to touch it. So it can be very triggering if perhaps your birth didn't go to plan or if the C-section is as a result of a hysterectomy. We will need to give ourselves a grieving process time for both of these things. Scar mobilization and the techniques that we're going to use are really simple. However, if you do not feel ready, that is totally okay. You can just take this information and sit with it until you do feel ready. We're going to go through some basic skin stretching and desensitization, both around the scar and directly onto the scar. Healthy skin recovery, helping skin to recover its experience of feeling more like normal skin. Because a lot of women say they feel like their skin just feels different or weird after surgery. And so a really hands-on technique works to help to reconnect your brain and to the skin that has been scarred. Okay, let's go through some frequently asked questions that I get. The number one question I get is, is it too late for me to start? My C-section was 2 years ago, 5 years ago, 10 years ago. The answer is no. It is never too late to start healing. And we know from the research and the subsequent results that with intentional scar tissue movement and work, we can really see improvements right down to a cellular level with the collagen fibers. We know that these techniques can help with the aesthetic look of the scar itself, the way in which the tissues move. It can help diminish adhesions, which can be causing pain, and finally just overall movement. With that being said, we do get the best return of results in the first 2 years postpartum or post-surgery, because this is when tissue is starting to remodel. However, by applying intentional stress like we do in scar tissue mobilization, we can see results at any stage of healing. The second question I always get is it painful? So if it is painful, it means that you are putting too much intensity onto the pressure. However, you can experience tightness, tension, bowing, maybe just a little bit of discomfort. But if you feel pain or numbness, then I would encourage you to talk and see your provider at your 6-week checkup. You may also experience a little soreness the next day, but you should never feel pain. Okay, why did no one tell me about this before? Why didn't the people who were responsible for looking after me after this major surgery tell me this information? And why is nobody talking about it? Well, unfortunately, the same can be said for most pelvic floor, pregnancy, and birth topics. And the answer is, I honestly don't know. But it is why I'm here. I'm going to help be the voice for changing this narrative, along with some other amazing women out in the industry. Knowledge is power, and I want to give you this information so you can gain autonomy back over your own body again. As I mentioned before, these techniques are not new. They are safe and they are widely used for other surgeries like back, knee, shoulders, etc. We also know how important it is to move scar tissue to help the tissues, the skin, the fat, and the muscle to function effectively. So why is this not being taught to women after surgery for a C-section? The answer is women deserve better. Simple.